Hi, so we are going to talk about anti-influenza virus drugs in this lecture. So we have talked about anti-herpes virus drugs in the last lecture. And so now we come to the anti-influenza virus drugs. So for this, the anti-influenza virus drugs, it's very simple. There are mainly two mechanisms of actions of these drugs. The first mechanism being they are going to inhibit the M2 proteins. First is M2 proteins. So this is your M2 protein here. And if you remember, what is the role of this M2 protein? Here, this is important for the influx of the H ions inside the virus. जब virus अंदर चला जाता है in the host cell, there is influx of H ions inside the virus, and because of this influx, uncoating happens. और जब uncoating हो जाती है, the outer coat is lost. Then it goes into the next phase of, losing its capsid and then entering into the nucleus of the host cell and multiplying. So if this uncoating is prevented, the replication does not occur. So here it inhibits the M2 proteins and therefore there will be no uncoating and it will prevent any kind of viral multiplication. The second mechanism of action is it inhibits the neuraminidase enzyme. Neuraminidase. So again, if I enlarge this a bit, this is your neuraminidase. And what is the role of this neuraminidase in this virus? So here if you see, I told you, it is important, this neuraminidase, for the budding. यहाँ budding हो रही है ना? This is important. It attaches to this and leads to budding, and ultimately it leads to release of the virus. So if you prevent this neuraminidase, so there will be, what will occur? There will be no budding and no release. So it will not go and infect the other cell and the infection won't spread to the other cells in the body. So these are the two main mechanisms of the anti-influenza virus drugs. Now in the drugs, the first one, which is amantadine and rimantadine, these two drugs, they are the M2 protein inhibitors. They are M2 protein inhibitors, while the rest of them, oseltamivir and the other drugs, they are neuraminidase inhibitors. Neuraminidase inhibitors. So amantadine and rimantadine, these drugs, they are effective against influenza virus type A, influenza A infections, not against influenza B. So they're not that much used these days now because of this. In addition to this, jo ye amantadine, if you remember, it is also used in Parkinsonism. Okay, though it's an anti-influenza drug, but it has been found to have some effect on the dopaminergic neurons that are useful in Parkinsonism. So rimantadine has a long half-life. That's the only difference. Otherwise, sab kuch same hai. It has a longer half-life as compared to amantadine. So not really much in use now because it has narrow spectrum only against influenza A. So it has a variety of side effects, and the most important, the being, it is caused as livedo reticularis. We पूछते हैं कि livedo reticularis, bluish pigmentation, especially seen the legs and all in the pigmentation of the skin, that is seen with amantadine. Then another important one is ankle edema. These are most important side effects which are associated with amantadine. Coming to the next drugs, all of them are going to be neuraminidase inhibitors. The first one we are talking about is oseltamivir, which is the most common and most preferred drug now because it is effective against influenza A as well as influenza B. And even those swine flu, जो कि हम H1N1 है क्या? It's a type of hemagglutinin and neuraminidase. H1N1, bird flu, ठीक है? Bird flu is H5N1. So ये जो सारे viruses हैं इनके against H5, it is effective. So it is one of the drug of choice for these drugs, and it is given in a dose of 75 milligrams twice daily for 5 days. This is important to remember about this particular drug. And it is usually it is very well tolerated, could have some allergies or rare cases में hepatitis etc. cause कर सकता है. But otherwise it is one of the preferred drugs for influenza infections, A as well as B. Zanimivir, same mechanism. The only thing it is available, it is इसकी bioavailability ऐसी नहीं है oral, because this is oral. ठीक है, so it is bioavailability नहीं है, so it is given by aerosols. Inhalation, and it is available as a dry powder. It can be given for disinfection, and iska jo major side effect is because of this inhalation is bronchospasm. Causes bronchospasm. That's one problem with this drug. Never to give them in COPD or asthma patients. Peramivir, again similar mechanism. It is to be used by IV route in emergency conditions or serious conditions of influenza, in emergency states. So these are the drugs which are used as anti-influenza virus drugs. Very few drugs here to remember. So please remember that they follow two major mechanisms, inhibition of M2 and inhibit the neuraminidase. So ये यहाँ पे और इधर, ये दोनों mechanism. So यहाँ पे होने से अनकोटिंग और रेप्लिकेशन नहीं होगी, और न्यूरामिनिडेज को इनहिबिट करने से बडिंग एंड स्प्रेड टू द अदर वायरस नहीं होगा, टू द अदर सेल्स नहीं होएगा. Amantadine, Romantadine are the M2 inhibitors, and they are not very much preferred these days because of its narrow spectrum. It's only effective against influenza A, but amantadine is also used as anti-Parkinsonian drug. So an antiviral used as an anti-Parkinsonian drug, the answer is amantadine. Levator reticularis and angioedema are the side effects caused by this. Oseltamivir, it is a neuraminidase inhibitors, and these are the preferred drugs. This is a preferred one these days because it is a broad spectrum and also effective against swine flu, bird flu के लिए काफी effective. Zanimivir same है, but it is available as a inhalational powder. Peramivir for emergency conditions given by IV route. So with this we come to the end of drugs which is used as anti-influenza viral drugs. In the next lecture, we'll be talking about anti-hepatitis virus drugs. So till then, take care. Thank you so much.